Hello and welcome to week 5, almost halfway through because this is a summer term and we only have a 10-week class. So there you go. How exciting, right? All right, this week we're going to talk about population health. And that is, of course, your chapter that you'll be reading in the book. But I want to give you a different angle on population health. And I also want to let some of you know that, it's a wonderful career path for HIM professionals to go into population health. But let's talk a little bit about the numbers. So when you talk about health outcomes, did you know that 10 to 20% only of somebody's positive health outcome or negative health outcome is directly related to the medical care they receive? 30% has to do with genetics. 40 to 50% has to do with lifestyle behaviors, and 20% has to do with social and physical environment. And so what we have here are individual behavior plus environment is non-medical determinants of health. And we are finally in the healthcare industry opening our eyes to really investigate what else is involved in a positive patient outcome besides the actual particulars of what goes on in the doctor's office or the hospital. So we are studying SDOH, and that stands for social determinants of health. And these are conditions that surround every person every day that directly affect their health, their functioning, and most importantly, quality of life. And I say that actually is so important because if you don't have quality in your life, I mean, is it really life? But as healthcare professionals and healthcare professionals of the future, we need to understand and get involved in everything we can that can positively impact social determinants of health in our communities. So we can not only be sure that vaccination needle is sterilized, but that as much as we can influence around this individual is perfected to support good health. So let's go over the 5 key determinants of health. We have economic stability, and that, ladies and gentlemen, is the money, honey. But it's not only having money. I'm sure you've heard money cannot buy happiness, and maybe a little more so money can buy good health, but only in certain ways. It is an element of the good health of any human being is economic stability. Education is very important. And I'm not talking so much about high school diploma, college degree. That's not as much what it's about, but educating yourself and your family with regards to what has an impact on your health and what you can do, no matter how much money you have or don't have, because there are resources. And you have to be educated about those resources in order to be able to partake of them. For example, anybody with any kind of health insurance has free preventive care, like flu shots and annual physicals and things like that. And there's a whole long list. Okay. So that's an example of where education overrides economics, because you don't need any money. You just have to know about the free stuff. Okay. The COVID vaccine is now available for free. The government is paying for it. You don't need money. You don't even need any health insurance. And you can go to any Walgreens or CVS or Publix or grocery store, wherever, and get the vaccine, and it's free. So again, but before you can take advantage of something that's available to you for free, you have to know about it. You have to be educated. Okay. Social and community context. And and what that means is, you know, human beings are community. We interact. And I know with COVID, it's of course been socially retarded, but you can still have, just like we're doing right now, Zoom. There can still be that support. You can get psychiatric care, a therapist to talk to via text message or Zoom. There are still things that can be done, but you got to know about them. The internet helps a bit, huh? Yeah. Health and health care, again, access. We talk about access a lot. And of course, in order to get health care, you have to have access to a healthcare provider. Yes. But do you know everywhere where they're available? Maybe not. And then neighborhood and built environment. And this has to do with something that you can get involved in, which are the materials of the houses and the apartments in which we live. And more green space, more trees are better for the air. And we're going to talk a lot more about all of these things right now. Okay, so let's talk a little more about economic stability. Economic stability includes employment, because that's where the money comes from, having a job, right? Okay. But then we also have food insecurity. And there are neighborhoods where the grocery stores don't necessarily have good quality food. Food is not available in some rural areas. So yes, there are actually areas here in the United States that have food insecurity, meaning there is no constant source of food, especially healthy food. Housing instability. And this certainly is something that needs to be considered, because if someone constantly has short-term leases on their an apartment and they have to move, or if they're living in a building that is condemned, or anything where there's not a place where you can go and live and be comfortable and go there again tomorrow. Now, again, this may be something that you're not even familiar with, which I'm glad, but when we need to seek out and see how we can provide for other people. And then there's just downright poverty. Now, over the last year and a half, we have lived through this pandemic, which caused a lot of people to be thrown out of work. And now things are finally starting to come back, but it's not that easy. It's not that easy, especially if, because you lost your job because of the pandemic, maybe you lost your house and you got evicted from your apartment because you couldn't pay your rent. That makes coming back out of this much more difficult as getting into it. So one thing that you can do as an up and coming health care professional is find out more about what's going on in your neighborhood, in the community around your facility, and see maybe you can volunteer, maybe you can donate stuff, maybe you can do a fundraiser or participate in a fundraiser. There are lots of things that you can do to help people who are not as well off as you are. Okay, we talked about education, and here you are in college, and that's very, very important. But we also know that early childhood education and development, pre-K, as well as kindergarten, is very, very important for the life of the individual. Did you know that the greatest scope of learning that a human being goes through in their entire life is between birth and age 4? That's maximum learning time. What if they're in a situation where no one is teaching them? Enrollment in higher education. You guys are here. Excellent. Okay, maybe we can do something to spread the word and help others know that they too can enroll. Getting individuals through high school, because high school graduation is a big moment. And you may have taken it for granted, which you shouldn't have, because it's a good accomplishment. But the fact is that there are other people who struggle because of their home life, because of their community, because of what's going on, that makes it more difficult than the average person. And then, of course, we have language and literacy. Now, language, you must have language skills in order to learn, because you have to understand what is being taught to you. However, there are lots of opportunities to get translators if someone is here that does not speak English. It's true. Via the phone. We in healthcare have these established connections with interpreters because we have to communicate with our patients. And if we happen to have a patient who does not speak English and I don't speak Portuguese, somehow I still need somebody who is HIPAA compliant, who can interpret. And you don't necessarily want to depend on somebody in the family, because maybe the adult is too embarrassed or does not want the rest of the family to know. Just because they don't speak the language doesn't mean they're not entitled to their privacy. So you could find out about that. And literacy. This is very important because this is the ability to hold on to education so that you understand. And having proper healthcare literacy is very important, especially in healthcare. And I'm not even talking about being able to understand the doctor when they're talking medical terminology, although you all have taken medical terminology, so you're prepared for that. But what I'm talking about is even trying to shop in the marketplace for a healthcare plan. Do they understand what a deductible is, what a premium is, what a copay is? We're talking about knowledge and understanding, and that is not automatic with an education. Maybe you have the gift where you can help your neighborhood understand at your church or at your synagogue or at your mosque. There are lots of places where you can reach out and use your skills and your knowledge to help other people. Social and community context. So now we are talking about not just socializing as in joining a club or your neighborhood watch or something, but it could be civic participation, volunteering, to work the polls on election day, or just drive people to and from the polls. If politics is something you're interested in, okay, or just the civics of the way we run things, working to prevent discrimination. And I'm not just talking about marching or sit-ins. I'm talking about education and standing up for people when they are discriminated against, and making sure it's not happening in your facility or in your neighborhood. Okay. Incarceration, people in jail and prison, um, of course, they are, due to being confined. All right, in jail and or prison, they're not getting healthy, nutritious food. They are not getting healthy, nutritious exercise necessarily. But maybe it's help getting visitation from family members that can prop them up. Maybe it's education, participating in GED classes or health education classes. Maybe it's just helping a family whose father or mother is released from jail or prison and they need that support. There are community organizations out there that do these things, but all of this contributes to a person's overall health. And of course, social cohesion. We used to have community centers, and not that long ago. Now, of course, COVID kind of put the kibosh on that. But now that things are opening back up, there are lots of clubs playing mahjong and bridge and chess clubs and bingo and just getting together for a cup of coffee. All of this contributes to the good health of the people in your neighborhood. Health and healthcare. So, of course, you need access to healthcare. There needs to be a hospital and or a clinic, certainly primary care, and like your PCP. Um, and sometimes people only think of this as something dedicated as a hospital, but there are lots of clinics. There are lots of neighborhood. There are lots of neighborhood clinics, free clinics in areas. They need registration forms filled out. They need management of health information. You could volunteer to help a free clinic. Okay. And health literacy. And yes, this is the second time I mentioned this because it's important. It's so very important that we understand that even children are not necessarily getting what they need to know about healthcare. Teenagers, there was a survey done, and I want to say maybe middle schoolers, and they asked them what sex was, and they didn't really know. They thought sex was intercourse, and that's all. But we have to remember that there are lots of other things that teenagers can do that can exchange bodily fluids. And if they're not educated, if they don't know, they don't know. Not to mention, the whole pregnancy thing. So you could participate in handing out flyers or brochures, or volunteering to talk to a Girl Scout troop or a Boy Scout troop, or at the local Boys and Girls Club, or whatever. This is not something where you have to dedicate the rest of your life, maybe one day a year, but you can contribute. And the last category in social determinants of health: neighborhood and built environment. So built environment means construction. Okay, that's pretty easy. Not trees that Mother Nature planted, but buildings and apartment buildings and even stores and malls and things like that. we have to make sure that people have access to food that supports healthy eating patterns. Okay. And in a way that they can afford it. This is important. So if you don't already know, there's an organization called Ugly, and they package ugly foods that people don't buy in the stores because maybe they have an extra bump where it's not normally, but it's still nutritious and healthy. There's a cooperative of farmers markets that support low income neighborhoods, so that they can, and they donate fruits and vegetables to organizations. When I was working at the hospital, once a week we would have farmers market people, and they would come and they would set up in the cafeteria, the staff cafeteria. Well, actually, patients and families went there too, but they would set up and they would sell fresh fruits and vegetables and whatever the nearby farms were, fresh at a really discount price. It was great. Okay, so there's lots of things that you could coordinate or join on board that really help. And maybe the place you start is in your own home. Okay, we all know how easy it is to go through a drive-through and get dinner because you're exhausted from working all day. Okay. And with COVID, so now what? Instead of that, you have Uber Eats, Grubhub, right? But the fact is actually, I think Uber Eats and Grubhub make it a little easier to get healthier food instead of just fast food. And let me be very clear, I am not anti-fast food. A quarter pounder with cheese is one of the most delicious things ever. Okay. Although I do prefer Wendy's fries. Okay. Although sometimes I like Sonic's potato tots, but the point is you have to have balance in your life. And there are people out there who either don't know or they just assume that they cannot afford it. Because I got to tell you, it's true. You go into the produce section of the grocery store, and the fresh fruits and vegetables, you can get like this much for the same amount of food that you could buy, 25 cans of beefaroni. Maybe not the best example, but still, you understand what I'm saying. Okay. Crime and violence just does really interfere with someone's good health, especially the violence part. So maybe you are interested in helping at a domestic abuse women's shelter or educating women on the choices that they have. All right. Again, we're back at environmental conditions. It's all nice and good to have urban areas, but you got to have green. You got to have a tree, a plant, something. Oxygen, remember that from biology class? And then of course quality of housing, and yes, it can be difficult to get repairs done, especially if you're not handy. So maybe that's something that you can get, go on Angie's list, or now it's just called Angie, or the other one, Home Advisor, and maybe get together a group of handymen and go into a low income area and offer to nail a couple of boards and spackle some holes in the wall or whatever. The point is that just making the effort is good for your soul, and it's good for the souls of the people in your neighborhood, and it'll help everybody be healthier. This really is important because your community health is everything. And if you know anybody that has any kind of health problem, then you already know that if you don't have your health, you don't have anything. You know how, if you've been sick while you're in school, you know how it can interfere with your ability to get your assignments done, which interferes in your ability to graduate and get a better job. It's all this domino. Everything is connected. There are social policies out there. You can volunteer to be on a community board. Again, trust me, everybody's meeting on Zoom. You don't even have to go anywhere. You don't have to get a babysitter. You just have to do a Zoom once a month or once every 3 months or whatever it might be. But the point is that everything has a impact on people's health. So talk to your friends, talk to your peers, talk to your coworkers, and see what you could put together just one day a year to help your community. And you know what? If you do one day a year and you do one day a year and you do one day a year and you do one day a year, do you know what that all adds up with? A whole year of good. And we can all do it. Okay. All right. So this week you are reading chapter 9, Public Health Responsibilities of Healthcare Practitioners. All right. This will not cover social determinants of health. I know you're excited, Oliver. He gets very excited talking about social determinants of health. He really does. Okay. That's my Yorkie. Oh, all right. Then you're going to do your homework. And I did post a link in your course room this week, week 5. So you can learn more about social determinants of health and see what you may be able to come up with to help those around you in your community. It doesn't take as much as you think it does. All right. You know, I am here. I am on your side. I am ready, willing, and able to support your learning because I know it's part of your future success. So if you have any questions, don't fret like Oliver is fretting. Just email me and we'll work it out. We can email back and forth. We can talk on the phone. We can do a Skype, a FaceTime, a Zoom, whatever you like. Okay? Have a good evening.